Hello and welcome to Juvenile Arthritis Explained. My name is Corrine Pinter. I'm a mom of a 15-year-old girl, Emily, who was diagnosed at 2 with juvenile polyarticular arthritis, and she today has psoriatic arthritis. Today we have with us, our guest is Dr. Leslie Favier, a pediatric rheumatologist at Children's Mercy Hospital. Dr. Favier is also a clinical assistant professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Thanks for being here.
Thank you so much for having me.
How can we help our child feel more comfortable and engaged during in-person appointments? Because like a lot of times some are really anxious or maybe scared, or some are just really shy and feel like they don't know what to say or what to do. Comfort. How do we make them more comfortable?
Yeah, and every child is different, right? So there's no one size fits all answer to this. And I think that the parent knows their child best. So you may have to kind of think through this ahead of time. Some kids need a powwow before you even step foot in the building.
Mhm.
Other kids are nervous for the whole week preceding the appointment. So this is going to be something that, maybe you need to have a parent-child conversation before about what to expect.
Mhm.
And then in some cases, if you feel like this is something that you need help from the provider with, I have had parents reach out to me ahead of time, either through a phone message or a portal message that says, hey, my child's really nervous. Is there anything else that we can do to alleviate fears, or is there anything that I can do to help alleviate some fears or kind of talk through the process with you to make you a little bit more comfortable? We also some institutions have something called child life specialists who can come, and if like, oh, lab draws are the real stress, we can have them prepared with some distracting techniques or a prize, things like that.
Yeah.
And with the shy kids, I'm used to kind of angling a little bit throughout the exam and the history taking to try and find some kind of common ground to get them out of their shell a bit. But that's why we
Right.
did pediatrics. I love working with kids, all different kinds of kids. So we're used to navigating.
Right. And sometimes I feel like it's when they're younger, they really
Mhm.
don't understand too much. And there is concern around appointments, and they are going to be a little bit more anxious. But I feel like you said, if it's more routine and they're coming to you for a while, all that tends to ease up. So as they get older, I mean, where I'm at now is it's pretty much my daughter's appointment, and I'm just in there in case I need to say something, which is nice. I mean, we get to that point. That takes a little while, but we do get to that point. What can we do as parents to prepare for these appointments to ensure that it's productive and informative?
I always, as a parent, even when I'm going to, provider appointments for my children, I like to clarify in my mind what my goals are ahead of time.
Mhm.
Some folks, they can verbalize that freely. They feel like they, can do it without the aid of paper, and others feel like yourself, like you want to bring some notes to kind of have, these are at least the things that I have goals ahead of time.
Mhm.
Um, Things that as a provider, I'm looking to hear. I would like to hear a symptom update. So, what is a day in the life of the patient? Are we having, struggles getting ready for school in the morning, getting dressed? Are we functioning and doing, the normal everyday kids
Right.
activities, playing with comfort, participating in sports? Are there medication-based updates? So,
Right.
are the medications going well? Are there struggles with them? Are there
Mhm.
adverse effects, or are we having logistical insurance issues? Anything that are, any of those points would be really good to mention. And
Mhm.
then, school or psychosocial updates. So, hey, we started baseball and we are struggling, or we're having, issues with anxiety in school and going to the school nurse a lot. Those are other things that I like to hear as a provider too. I really like to kind of hear about
Right.
the
Because it
whole
gives you a
lived
whole
experience.
picture. It gives you a whole picture of the kid and just how they're functioning and doing. So yeah.
What I don't need is, notes are good, but I've had families bring copious, like a diary of daily symptoms, and we can't go through something like
Mhm.
that together. But definitely some just enough to keep you on track, and so that way your you know goals are
Yeah.
checked off.
I try to pick kind of the most persistent thing going on with her within the time span from the last appointment to the next one. Cause generally it's about, 3 to 4 months between, unless something really flares up. So from my end as a parent, I really try to keep it like her pain, medication, like the adherence to the medication, any side effects, and just kind of she's not tired in the morning or she's doing well, or, oh, this really worked, or, those kind of things. And even the goods, like a lot of times we kind of focus on what we feel like isn't going right. But I know you as a provider like to hear like, this is working. What we're doing is working. Like this plan's really successful right now. And even if there's nothing really going on and it's kind of boring, that's probably best.
That's the ideal. Yeah,
Yes.
absolutely. And the other thing I forgot to mention was pictures. So if there's rashes, for
Yeah.
instance, I didn't mention that, but that, I mean, a
Yeah.
picture is worth 1,000 words. So if there's a picture of joint, swelling or a rash, take a picture of it. It's way easier for me to look at it rather than, it was
Well,
splotchy, it was
right. It's hard to
prickly.
describe. Yes, it's hard
Yeah.
to describe sometimes. So yes, pictures
Mhm,
are super valuable and are so
mhm,
easy to get to you guys now through these
mhm.
portals and emails, which is so nice. Are there any specific medical records or information we should bring to each appointment?
Yeah, so we can start with just like a new patient appointment. Oftentimes, we're actually getting a packet before you even come. We that we can review. So oftentimes, there's lots of pages of referral records, labs, and imaging reports.
Mhm.
We're able to kind of go through those. In follow-up visits, I don't get that anymore. So I'm not really sure about updates from primary care doctors, or if you've had labs done at an outside facility or an X-ray done at
Mhm.
an outside facility. I don't have those. So
Okay.
if you do have easy access to things like outside labs or imaging, I always say throw them in a folder if you have them and just bring them with you, or have your portal login access so that way we can bring them up. That would maybe cut down on repeat labs if we don't need them, if they're not necessary, or it would help me, if there was some x-rays done, I'd like to see those.
Right.
But otherwise, I don't think you have to carry that burden or stress of carrying a big medical record around with you, because most of the time I can request them, through faxing. Our facilities can communicate and we can get them.
Shot records sometimes depending, because I know when we go, sometimes like now, if we went, flu
Absolutely.
shots are a thing very readily available right now. So I know sometimes the rheumatologist will do that over her pediatrician. So I'll carry
Absolutely.
the shot record with me almost all of the time if I know we're into these seasons of vaccination. So that's the only thing
Excellent.
I would carry. Other than that, yes, everything electronically now or you've
Mhm.
gotten is good. Okay. So during appointments, what are key questions or topics we should prioritize in these appointments to address our child's current condition and the treatment plan?
Yeah, this is probably the most important question, right?
Mhm.
So, this is a really valuable time when the parent, the child, and the provider are all in the same space in the same room looking face to face. So, we want to make sure that, depending on the age of the child, that they feel heard and understood and comfortable, and that they're on the same page as us as well. Even the little, even little kindergartners and preschoolers are able to kind of pitch in the conversation. But as parents, we want to make sure that these kind of this valuable time is used to the fullest. So making sure we communicate, patient updates, symptom updates, but also what are your questions regarding medications? What are your worries, your concerns? Do you feel like you have an understanding about the disease? Are there kind of high level questions that you would like to, ask face to face, in terms of planning for the future and making sure that we're all on the same page? These are questions that are more, you know, better accomplished during an in-person, face-to-face um, conversation. A lot of the other, things like logistics or, easy questions can be on the portal or via phone messages. So just the conversation has to be something that wouldn't be amenable to like typing out on a portal. Those are the questions that we want to
Right.
really prioritize during the visit. Does that make
Right.
sense?
Yeah. And that's the biggest thing. Like you said, if there's, the child's condition, if there's new symptoms, if if their mental health changes, going
Mhm.
through, that's a big one lately that a lot of the doctors, no matter what appointment is, they're really cognizant about that. So even if you've noticed some behavioral changes or something like that,
Mhm.
um, and making sure, like you said, you understand the medications and stuff like that. You could have questions because there's sometimes we'll get prescribed something and have time to a little bit get some basic knowledge of it, but then later on you'll hear a commercial or you'll search it
Mhm.
up and you'll have another question. So that could be shot over through an email or through the portal. But if you have that kind of understanding, if you had a visit before and said, hey, we might switch to X, Y, and Z, that gives you time to research it as a parent to be able to come back to you as a provider and say, hey, I've got these questions or concerns or other things. So that kind of stuff, I think, on
Absolutely.
is helpful, right? Yeah.
Absolutely.